Right now, COVID-19 cases and hospitalization are on the rise. Paxlovid antiviral pills remain an option for mitigating risk, but how effective is it? Joining us live to discuss is 9 News health expert Dr. Payal Kohli. Dr. Kohli, good morning. Thanks for being with us.
Good morning, Jordan.
For people who aren't super familiar with Paxlovid, just remind us what it is.
So it's a medication that has 2 different medicines in it. So one is an antiviral pill that prevents replication of the COVID virus. The other is actually medication that increases the concentration of the antiviral pill. So it's 3 tablets, but 2 medications. You have to take them for 5 days. And the key here, Jordan, is you really want to start it within 5 days of your first symptom onset, because that's when the virus is really starting to replicate. That's when you want to hit it hard. And if you do start it early, it can actually reduce your chance of ending up in the hospital, of dying, of even developing long COVID symptoms.
I feel like the natural follow-up question to this is who should be taking this and who should not be taking this, more importantly.
Yeah, so you shouldn't take it if you have severe kidney disease, because it can affect the kidneys. It's cleared through the kidneys. Same with your liver. If your liver is not working properly, you want to talk to your doctor about whether or not you should take it. But really, who should take it is starting to grow that piece of the pie. Now, initially, we studied it in the highest risk people, who were the highest risk of developing COVID hospitalizations. This is anyone over the age of 60, anyone with a chronic medical problem like heart disease, lung disease, or cancer, and anyone who's been unvaccinated, because remember, these people are higher risk of going on to more severe illness. But more recently, there's been a controversy about whether healthy people should take it or not.
Right. Yeah, we've heard that. So I want to ask you, because of course, a lot of people will be wondering what the side effects of this might be.
Yeah, so it's not an easy medicine to take. So it can cause diarrhea. It can cause this really bitter sort of taste in your mouth, which is directly related to the medication itself. And it can interact with a lot of other medications that you take.
Which brings me to my next point. What medication should maybe, if you're taking this, avoid Paxlovid?
You have to talk to your doctor, because it's a long list. It's
True.
pages and pages long. And it includes medicines like statins for cholesterol. It includes medicines like blood thinners. It can include other types of medication. So I have a ton of my patients that are taking Paxlovid often call me, and I have to adjust 2 or 3 medicines, sometimes even interrupt the medicines. If you recall, President Biden had taken Paxlovid. They had to stop his Eliquis, which is a blood thinner that he's on for atrial fibrillation, and his statin medication. But to me, as a physician, I think we're sort of walking that fine line right now. We certainly want to give it to those high-risk people. The studies in the younger, healthier people are a little bit mixed, because on one hand, people are saying, well, if it prevents long COVID,
right,
then why shouldn't everybody take it, including those young, healthy people? And in fact, if you treat 1,000 patients, you'll prevent long COVID in about 25 of them. So it's pretty effective at doing that. But on the other hand, are we starting to develop resistance? Are we starting to breed strains of the virus that might be resistant to this? Just like with antibiotic resistance,
right,
if we start to use it on a population level, and if it's not going to be as effective in those young people.
As is the case with most things, this is something you should always just consult your doctor with, and this is a decision between you two.
Absolutely, but I want every single person to think actively about this decision, even the young, healthy people.
Yes.
Because depending on your underlying situation and your risk, you may benefit from being on Paxlovid, and I've started some of my younger patients on it as well. So just reach out to your doctor and talk to them about whether it makes sense for you, but just do it early after that symptom onset.
Okay, good to know. Dr. Kohli, thanks for breaking that down for us. We appreciate it.